the FDA will be notifying physicians that the use of acetaminophen, which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism.
I think the anticipation was, somehow some justification as to the position that vaccines might be contributing to predisposition of autism. It's just multifactorial. You'll explain that to us. But acetaminophen?
I mean, it was a big week, right? And it was a big press conference, and it's still very fresh. But I think a lot of people are certainly frustrated, and there's a lot of differing opinions on with that. There have been plenty of studies on acetaminophen. There has been a lot of concern around it for a while. There is a recent study from August from the head of public health at Harvard, so pretty science-based individual, I would assume, who put together a literature review of over 40 studies on acetaminophen in pregnancy and Tylenol, and concluded that there is some level of concern. It's not consistent at every single study, but the majority of good studies do seem to lean in the direction of small but appreciable risk of an increased risk of autism from Tylenol use in pregnancy. And with that study, I think it's completely reasonable to provide caution, to provide concern. With the rising rates of autism and the concern around autism, we should take precaution. Every medicine has a risk. It's not 100% for sure. There are studies that don't show it. That was a massive study, 2.5 million kids, and they didn't actually find an association. They studied for genetic differences, so it looked at siblings, and the actual findings didn't show after that. There's more research that needs to be done, and it's not definitive, but totally reasonable to make the announcement on that. Totally reasonable to warn people. Totally reasonable to not take Tylenol if you don't absolutely need it. So you have to weigh with your doctor whether the risks that are known from the medication are still warranted, given you still might need the medication.
Right.
So I think that's the way we have to look at everything.
I think opening the door is the most important thing to the conversation.
That's science.
Yeah.
Remaining open, having the conversation.